Good evening, everyone. My name is Joy Connolly, and as Provost and Senior Vice President of the Graduate Center, I have the privilege and pleasure, really, tonight of welcoming you to the Graduate Center of the City University of New York. And for those of us who are watching us, or those of you who are watching us through live stream, I'm waving to you. Thank you for joining us from afar. As many of you know, this building is the home of pioneering research, of Nobel and Guggenheim and Pulitzer winners, and of PhD students who President Chase Robinson and I are never tired of saying teach about 200,000 CUNY undergraduates every year. We're especially proud to rank among the country's top 10 institutions in awarding doctorates to students from underrepresented minority groups. Tonight marks the latest installment of our very contemporary, timely series, The First 100 Days, programming in an 8-part series designed to help us all navigate this unusual, especially divisive political era. Conversations over the past weeks and in the next few weeks have delved and will delve into trade, inequality, power, and other timely themes, all featuring Graduate Center scholars and other national figures. So we hope you'll come back often. It's our hope, honestly, that we'll develop in the course of these conversations, not just, we won't just gain exposure to new ideas, but we'll develop new habits of thought, and especially new habits of dialogue across political views, so that we learn to talk not only with the people who agree with us, but with the people who don't. This evening's event is especially timely. And just over a week ago, as we all know, Republican leaders failed to repeal the Affordable Care Act. In the face of this defeat, President Trump warned that Obamacare would, and I quote, explode. But Speaker Paul Ryan has just said, we're going to be living with Obamacare for the foreseeable future. Now, President Trump has also vowed to cut taxes and reduce support for programs that help the poor, such as Medicaid and food stamps. He and Senate Majority Leader Mitch McConnell have both promised that Republicans won't touch Medicare and Social Security. All this political maneuvering, then, begs for clarity. What is going to happen? What's going to happen to Obamacare and the rest of the social safety net over the next 4 years? Who's going to benefit? Who's going to be harmed in the process? What's at stake for the more than 8.5 million people in our hometown in New York City? It's been increasingly difficult to decipher policy positions in the midst of all this hyperbole. So we're fortunate, very fortunate, to be joined tonight by 4 experts who can help us answer these vital questions from different vantage points. This discussion is emblematic of what we do best at the Graduate Center, what we do every day. This is an incubator of vigorous debate reflected in our doctoral and master's programs, our 30-plus centers and institutes, and the dozens of events held here every week. So for these and many other reasons, we're pleased to present this event, an in-depth talk with some of the nation's most prominent scholars and policymakers. So let me now introduce them. Mary Travis Bassett, if you can nod, thank you, Mary, is the Commissioner of the New York City Department of Health and Mental Hygiene. She's dedicated her long and impressive career in medicine and public policy to advancing health equity here in New York and overseas. Prior to her current appointment, she led the African Health Initiative and the Child Well-Being Program at the Doris Duke Charitable Foundation. As Deputy Commissioner of Public Health and Disease Prevention under Mayor Bloomberg, she directed key initiatives such as the bans on smoking and trans fats in restaurants. Sheldon Danziger, thank you, president of the Russell Sage Foundation, is a nationally recognized expert on the effects of economic, demographic, and public policy changes on trends in poverty and economic inequality and on social welfare policies in the United States. Previously, he held 3 titles at the University of Michigan: Distinguished University Professor of Public Policy at the Gerald R. Ford School of Public Policy, Research Professor at the Population Studies Center, and Director of the National Poverty Center. Our own Janet Gornick, the end there, is a professor of political science and sociology. She's also the director of the newly named Stone Center on Socioeconomic Inequality and director of the U.S. Office of LIS, formerly the Luxembourg Income Study. She's also a LIS senior scholar. A prolific scholar and author, she focuses much of her research on social welfare policies and their impact on gender disparities in the labor market and income inequality. Michael Strain is the Director of Economic Policy Studies and the resident scholar at the American Enterprise Institute. His research interests span labor economics, public finance, and social policy. The editor of 2 books on economics and economic policy, he's published op-eds and essays in leading news outlets such as the New York Times and National Review, and he's a regular contributor to the Washington Post. And finally, leading the discussion is policy expert, advocate, think tank executive, and writer Felicia Wong. She is the president and CEO of the Roosevelt Institute and is well known for championing policies that fight inequality. Under her leadership, the Roosevelt Institute gained widespread attention for its report, Rewriting the Rules of the American Economy, which provocatively called inequality a choice reinforced by public policy. Last year, the New York Times Magazine quoted Felicia as describing America as, and I quote, a fear-catalyzed gated community for a privileged few and a violent, racially hostile, Lord of the Flies race to the bottom for the rest of us.
I didn't say we were there yet.
Good. Thank you for that clarification. We can be slightly pessimistic and not totally pessimistic. That's good to hear. In all seriousness, tonight, Felicia will talk with these leaders and scholars from both sides of the political aisle who are known for shaping and analyzing social policy. And on behalf of all of us at the Graduate Center, we thank them and we thank you for taking part. Have a good evening.
So much. Is this on? Is this on? Great. Well, good evening, and thank you to Joy and to Janet and to Karen and the entire CUNY team. In an age where more informed civic engagement is absolutely critical to healthier public life, CUNY's public programs are a welcome and vital part of our city's lifeblood, and I'm fortunate, as are we all, to be able to take part. As Joy said, I'm Felicia Wong, and I run the Roosevelt Institute. We're a small think tank here in New York, and we're dedicated to making the human-centered values of both Franklin and Eleanor Roosevelt real in the 21st century. I will be moderating tonight, and we're very lucky to have 4 terrific and very diverse speakers. It's kind of an embarrassment of riches, and we have a big topic, so we'll get right into it. Our question for the evening is, what can we expect from our social safety net in the era of a Donald Trump presidency? So let me tell you a little bit about what's going to happen. Everyone will lead off, I think, with a 2-minute or so statement about what they hope for, hopefully not a fear-catalyzed gated community, what they hope for, maybe a little bit about what they're concerned about, and then we'll start some round-robin questions amongst the entire group. I think we'll go until about 7:45. And there's so much here that we'll be able to have, I think, a very robust conversation. So let me just say a little bit about what I think we mean by safety net, about what is both on the table and not necessarily on the table for this evening's conversation. I think we're going to try to define safety net as follows. We mean government cash and services that go to support the poor or the near poor, and the goal of the safety net, which in many ways was the product of the Roosevelt's New Deal, at least the modern safety net, is to protect people from the very worst ravages and hardships of life. So we can also think about this as interventions to rectify the inequality that's inevitably caused by the market. And I think we think of it in 4 major buckets. The first is all the big health programs, Medicaid, Obamacare, and perhaps the AHCA as proposed, and sometimes, some days it's reproposed, some days it's not reproposed. We'll get into that here. The second bucket is the other major anti-poverty programs, things like food stamps, TANF, WIC services. There's a range of services that are specifically anti-poverty. We're also going to touch, and I think this is Janet's unique contribution, on work and family policies, child care, paid leave, and other kinds of working family policies that are just critical in the modern economy. And finally, we'll talk a little bit about whether we can expect to see any kinds of changes in the large social insurance programs, Social Security and Medicare in particular. So that's a very big set of policies to talk about. There are some things that we are going to keep or try to keep off the table for the evening. So we're not going to talk about police violence and criminal justice reform. We're not going to talk about immigration policy. We're not directly going to talk about K-12 education. We're not going to talk about infrastructure investment. Even though all of these things, of course, affect people's income and poverty, we're not really going to talk about them directly this evening. I also don't think this is going to be specifically about taxes or about fiscal policy, although it's hard to get away from taxes because eventually you get into the question, well, how are you going to pay for that program? So we may touch on it, but again, this isn't centrally about tax policy. So that is at least my attempt at a definition of what we're going to be discussing tonight. I'd like to go ahead and get started by asking Janet to kick us off with 2 minutes on what she hopes for.
Thank you, Felicia. It's a great pleasure to be here with this great group. I would say I agree with this, by the way, this brief description of what we mean by this safety net. I've taught social policy here at the City University for 24 years. I'm happy to say a pleasure and a privilege, and we begin all those classes with the question about what are the boundaries around social welfare policy or the safety net. And I think it's sort of a futile exercise to be too precise, but I would agree with that. I think it's important to note that these large social insurance programs, Social Security in particular, are in fact anti-poverty programs, even if they're not targeted on the poor. So we think of them really as a large group, although all these different components, and I think this is a lot of what we'll talk about tonight, they function differently, they're financed differently, they're targeted differently, and thus they have different political logics. And partly for that reason, some of them might be in peril, some of them the new administration may try to cut. I use the term in peril to mean try to cut. I'm not a supporter of cutting most of our social programs. And others of them, they may try and not succeed. So I think this is part of what we're going to try to tease out are their logics. When the new administration came in conjunction with the congressional results as well in November, I thought about three things. My first concern, like so many, was what about the Affordable Care Act, which so many of us had been watching for such a long time. And I also thought about the large social insurance programs, but also about work and family. So let me just say a sentence or two about each of those. I was saying in the autumn that I actually was the least concerned about the Affordable Care Act, which seems somewhat paradoxical because it's I, like so many, was waited for many, many years and decades to see something like the Affordable Care Act. But the reason I wasn't terribly worried was because, as we know, its opponents shifted from talking about repeal to repeal and replace. And I didn't think there was a replacement. I didn't think there was a replacement in the wings that was feasible or politically viable. I don't think that was a brilliant bit of prediction, but I think, in fact, that's really what we saw, was this sort of secret plan that was going to come out from the woodwork, didn't really appear, and then when it did, it wasn't successful for reasons I'm sure we'll get to. A lot of people have been saying this for years. They had 7 years to show a replacement. There really wasn't one. The Affordable Care Act is a conservative plan, and so a better conservative plan was hard to imagine. The large social insurance programs, just simply to say, I think most of you know, Trump said many times during the campaign, which distinguished him from his colleagues, that he was not going to touch Social Security or Medicare. He tweeted a rather boastful remark that he was the only Republican candidate to say such a thing. What does that mean? We don't really know, because that view is not held by his colleagues in Congress. So I think this is a question. In some sense, I think some of us have sort of sat easily and thought, well, these programs are not going to be touched. But we really have absolutely no idea if the Congress will capture him or he will capture them, or what will happen. We just saw. It's not clear who has the upper hand. And finally, we'll come back to this, but I was very, I sat up and paid a lot of attention when the Trump campaign put out a program for childcare and paid family leave. Extraordinarily unusual for Republicans to do such a thing. So we'll come back to that. I don't want to take too much time. It was unusual. They were both, they were not progressive plans, either of them, but it was a sea change to see those topics on the table on the Republican side, and I'm really eager to see what will unfold.
Great, thank you. Sheldon, what do you hope for?
I'm trained as an economist, so I just have fears and not hopes. I thought I would say something about my view about the safety net, and I think the conventional wisdom, which the Heritage Foundation began saying at least 25 years ago, and almost every Republican, although I don't think Trump has bothered to think or talk about this, will say, well, obviously the safety net doesn't work. We spend trillions of dollars on government programs and poverty stays high. And then it usually follows the safety net creates a hammock or a trap that treats the poor. So I thought I would begin by simply saying the safety net hasn't eliminated poverty because the economy has generated so much more poverty and inequality than anybody imagined 25 years ago. And if you actually look at the social science research, some of which I've done, a lot of which was funded by the Russell Sage Foundation before I got there, let me just mention three particular areas. Let's start with the job-killing Affordable Care Act. I'll go in backwards order. As many people have noted, unemployment has been falling and employment has been increasing steadily since the end of the recession. The Affordable Care Act worked to reduce the rate of uninsurance, and it paid for it by taxing the rich, which is a pretty good notion of a program designed to help the poor and reduce inequality. The previous one, the Stimulus Act of 2009, reduced poverty and unemployment at a time when the economy was generating a lot of poverty and unemployment. A very recent article in the Public Policy Journal by Hillary Hoynes and colleagues shows that the increase in safety net spending on food stamps, tax credits, and a variety of other programs really helped cushion the very severe market losses that occurred during the recession. And the third is the War on Poverty programs that have gotten such a black eye in public discourse, dramatically transformed the safety net. Head Start, Pell Grants, Medicare, Medicaid, food stamps. Again, if one looks, the Center on Budget routinely puts out information that shows how many millions of people are taken out of poverty each year by various programs. So in some sense, I think we're beginning in a period when the conventional wisdom and discourse, even in the best of times, has been hostile to safety net programs.
Well, I want to come back to that eventually, and I want to come back especially to your historical view, the roots of some of these programs and the roots of some of the political dialogue. But I want to turn now to Michael. Michael, I'm interested in particular in your view and to see whether you would agree in large part with Sheldon's primarily optimistic view of what the safety net has done to alleviate poverty.
Yes, I do agree with Sheldon in broad strokes. I mean, let's do a thought experiment. So let's say that we woke up tomorrow and we eliminated all of the safety net programs that Sheldon talked about, safety net broadly defined. Do we think we would see poverty go up or down? Poverty would increase dramatically, I think. It's very hard for economists and social scientists to come up with estimates of the total amount of poverty that's reduced by the safety net because it's hard to construct a counterfactual and all sorts of other technical reasons. But maybe the current safety net programs cut poverty rate in half something like that. If you think about a program like Social Security, you know, these programs exist for a reason, right? People didn't come together in Washington and say, oh, okay, what are we going to do this week? Oh, I know, let's, come up with a food stamp program. We have the food stamp program because people and children were dying of hunger. And people decided that was not an acceptable situation. We have the Social Security program because the elderly were dying in tenement houses of exposure to the elements and of disease and of all sorts of other horrible things. So these programs sprang from real need and they address real need. Now they're not perfect. Many of them are quite flawed, and they need to be fixed, and they need to be altered. They need to adapt to the circumstances of today, and we all need to be clear that sometimes these programs have unintended consequences. Sometimes these programs do harm as well as do good. But I think if you look at what we have built over the last century, particularly over the last 70 years or so, it's a marvel. And it's something that we should all be proud of as Americans, that we've come together and created these programs to help the people in society who are most in need.
Thank you. Well, that's certainly something we're going to have to come back to, because I think what you have on the stage here is a range of conservatives and progressives, and yet you're hearing a lot of agreement here. So the question is...
We'll get some disagreement.
Well, okay, well, I'm going to come back to that too, but the question is, what's the problem, right? But before we go there, let's go to Mary. Mary, you run the Department of Health here in New York. You must hear much of this conversation about potential changes to various federal programs with some measure of trepidation. So what do you hope for and or fear as we enter this new era?
Well, the first thing that I want to point out is that I was appointed by a progressive mayor, the first progressive mayor that we've had in New York City in a good many decades. And I have a couple of interests tonight. One is to learn from my panelists, because my day-to-day job is actually looking after the health of the people of the city, promoting health, protecting health. And I also really want to convince the audience that we've come a long way and we have a long way to go. And that I'm hopeful that people will understand what's at stake in the coming years. And let me tell you a little bit more about what I mean by that. I mean, obviously, we always pay for policies. We pay for them with our taxes, we pay for them out of our pockets, we pay for them with our bodies. And many people here may not realize the price that we pay in this country with our bodies, despite spending more than any other wealthy country by far. When you compare our health outcomes to our peer nations, we're at the bottom or near the bottom for everything. So that's what you call, despite whatever the deal makers say in Washington, a really bad deal. And now we're in the situation where a bad deal is going to become a dangerous deal. So what was at stake with the Affordable Care Act? Well, in New York City, 1.6 million people, health care coverage, was threatened if the Affordable Care Act had been repealed. 200,000 of them people who use our public health system and who had insurance coverage to pay for their care in the public health system, which, as you know, is greatly threatened by the fact that many people use it who have no insurance. The other thing is something called the public, I'm going to get this wrong, the Prevention and Public Health Fund. And it pays for a lot of things. It gives my department $12 million a year, and it also contributed 12% of the Centers for Disease Control budget. That would have been eliminated. Now we have the executive budget. That's got huge cuts to health and human services, $15 billion, 18% of the budget, over a third of that, to be borne by the National Institutes of Health, which is our scientific engine for research in this country. And then we have agriculture, cuts to food stamps, the safety net that we've been talking about. When I think about the safety net for health, it doesn't just include healthcare services. It includes education, it includes jobs, it includes housing, it includes food security. So it takes all these strands, because among the many reasons that we don't want people to be unhealthy is that we don't want people to become poor. And another fact about our current situation, even with the Affordable Care Act, is that seeking and obtaining health care services was tipping a huge number, over 11 million Americans, about a quarter of people classified as poor, into poverty. So we have a situation, we have a healthcare system that is creating poverty. So that is not a system that is supporting itself, it's undermining itself. So I'm hopeful that we're going to begin having expanded discussions, and including starting in here in New York State with our mayor, who is now talking about Medicare for all, single-payer coverage plans. So, you know, the Affordable Care Act is worth fighting for and protecting, but we still have many problems that we have to address.
Yes, thank you. Well, I want to come back to the specific effects here in New York, but first, I want to pick up on this this hint of potential disagreement between the two of you, Michael and Sheldon, or agreement, because what's one of the very interesting things about your collective past is that you actually were part of an AEI Brookings study that brought together conservatives and progressives to try to develop a consensus view on anti-poverty programs. And given the history that you described, Sheldon, of much narrative denigrating the effects of anti-poverty programs, saying that they weren't helpful or ineffective, that they were ineffective, it's very interesting that you both, from different sides of the political aisle, tried to come together, along with a dozen colleagues perhaps, to work on a document that was going to bring people together across partisan divides. And in this time of great partisanship, I'd like to hear both of you talk about what that experience was like, and whether you think that experience will can drive any hope for the future. So Sheldon, why don't we start with you?
Sure. I think the last model we saw nationally was the Greenspan Commission in the 80s for Social Security, where it was realized we've got a long-term problem with the Social Security Trust Fund. A group of people came together, and the solution was modest tax increases over a long period, modest benefit reductions over a long period. That's when the retirement age got raised to 67 for people who were young today. When my colleague Ned Gramlich was head of a Social Security Commission in 1994, he thought that was the same solution at the time, and he came up with a plan that, when he presented it at the University of Michigan, at least convinced the academics, had modest tax increases over a long period and modest benefit cuts. And by then, I think on a commission of a dozen people, Ned got one person and 5 people said, I love your benefit cuts, but I won't vote for tax increases. And 5 people said, I love your tax increases, but I won't work for your benefit cuts. So I think the group that got together decided we were going to
This was 18 months ago, 2 years ago, something like that?
No, you're talking about our group.
Sorry, that's what, yeah,
our
right.
group issued a report about a year ago in December, so 15 months ago, so.
So a lot of partisanship, not
No,
quite the level
this-
of partisanship that we're
right,
seeing today, but
right.
sorry, that's what I was trying to,
Right.
okay.
And
good.
so I think our goal was, knowing the history, was to
Thank
try to
you.
do something in the space of poverty, opportunity, and responsibility. And we began by, I guess, agreeing we were going to listen to what other people said. We were going to agree to look at facts. I mean, this is shocking that people on both sides of the aisles could look and then we said, okay, here's a set of issues. And I'll give the example from the work area. Conservatives wanted to have more responsibility on the poor to support themselves and their families. And progressives said, well, it's okay to expect responsibility, but if you expect responsibility and you're going to cut off benefits to people who aren't working, you've got to make sure that they're not working because they're rejecting work, not because employers are rejecting them. So we agreed that the statement as written would be people were to have, who were to get benefits were expected to look for work and to take an available job, but there was this public service job of last resort or subsidized private job of last resort, and I think we came together in a range of areas on issues like that.
Michael?
Yeah. So it was very difficult. The people in the group all had established reputations. The people in the group most represented organizations that occupy a certain space in our public conversation, and it was hard. It was hard to come to consensus. It makes me hopeful because I think the reason that it worked, and Sheldon can present a different view if he doesn't agree. First of all, there was a shared moral consensus. The consensus was fundamentally.
Began with that, right? You began by talking about the values that you shared. Is that, or was that part of the spine?
No,
of the...
that took a little bit of time to come
all right,
together.
all right.
But the consensus that I think everybody in the room shared was that something needed to be done.
Mm-hmm.
That poverty was a serious issue. It was an issue that admitted compromise, and it was a big enough problem that people need to, swallow the subsidized jobs or swallow the extra responsibility on people who were receiving benefits in order to make progress. That was key. Secondly, people in the group exhibited what I think I would call intellectual empathy. And that's something that is very rare in Washington, where I work, and very rare in the public debate. We would gather. I think about half the time we were at the Russell Sage Foundation, about half the time we were at the American Enterprise Institute, and we'd sit in these rooms for 7 hours at a time. And occasionally, well, not occasionally, pretty often, somebody would say something around the table that would just be abhorrent to half the room. But instead of throwing rocks, people said, "Well, let me try and understand what you mean by that. Let me see. Let me try and pinpoint." Exactly why or exactly where I don't agree with where you're coming from, and that really helped. So we had a big debate about whether we wanted to include funding for pre-K, and I, among others, thought that was really not the right thing for us to do in the report. Many of the folks in the group who were on the more progressive side thought that it was really necessary. A couple months of going back and forth about it, and then one day one of the progressives said, "Well, is your issue basically that this is a federal program? What if we just suggested that the states run their own programs?" Well, I can live with that. And so that made its way into the report. So intellectual empathy was really, really important. And the third thing I think that made it work was that we actually formed a bit of community with each other.
And this was a 8-month program, so a project. I mean, so you worked
like
for a long.
year, maybe?
You got to know each other. Sort of.
It was supposed to be 8 months, but it took a year.
Spent a lot of time with each other in person, corresponded a lot over email, talked on the phone quite a bit in bilateral conversations, and so take those three things and now apply them to the current public debate, which is so nasty, so completely devoid of intellectual empathy, where there is no sense of community. The same thing's happening on Capitol Hill, and one of my great worries about the poverty space in particular, but not only about poverty in the Trump administration, is that whatever moral consensus we have that even identifies areas of concern could end up being chipped away.
Right. Well, I actually would like to have a conversation about whether you think that model could be useful in a post-Trump era, but let's come back to that because I actually now want to turn to Janet. Janet, you have been interested. You actually have shown some intellectual empathy. You've been interested in, as you hinted, you've been interested in some of what the Trump administration, Ivanka in particular, but also President Trump have put out around work and family policy. You see it as a change from what most Republicans have put forward in the past. How would you seek to build on this? And or do you take it seriously, or is it a political ploy?
All good questions. So just to back up for a moment, I think I would simply say, I know I've said this already a little bit this evening, just to point to how unusual this is. So during the campaign, the Trump campaign put out a very specific plan. I think people in the room here probably know, as a word of background, that the United States is really an international outlier in terms of programs specifically that support working people who are also caring for children. So we are the only rich country in the world that doesn't have, one of very few countries in the world that doesn't have paid maternity leave, the only rich country that doesn't have paid paternity or parental leave. We make extraordinarily few investments in childcare. We're an absolute outlier among the rich countries. And then other things just that are sort of in the background, we have a very low minimum wage. We have very few protections in the law that enable people to work part-time or work flexibly with protection. So it's a really rough country in which to work for pay, especially if you're in a low-income home and a low-wage worker with limited skills. I've been working for many, many years on looking in particular at paid leave and child care, which is almost never on the Republican agenda. So it was quite interesting during the campaign and got a lot of attention in the press that the Trump campaign put out a child care plan. It was a tax plan, but a fairly substantial one. And then they put out a plan for paid leave, which called for 6 weeks of paid maternity leave to be paid out of the unemployment insurance program. Women only.
Women only.
So the first thing to say is that both of these programs, in a sense, I was sort of excited and pleased and happy to see that the issues were on the table. Why were they on the table? I would just say quickly, I think there are three reasons, and so they tell you about the complexity and the fragility of the politics. One is obviously that Hillary Clinton was Trump's opponent, as I think everybody knows. And obviously the whole discussion about a woman candidate, she had a very progressive program. The chief economist for her transition team was one of the country's leading experts on work and family, and she was making it very clear that work-family policy was going to be at the center of her campaign and at the center of her administration. It was very convincing. So I think they were simply competing with her. Second of all, the Access Hollywood tapes came out. He was widely accused of being anti-woman, of course, and they needed to do something for the ladies, so that's the maternity leave. And then, of course, his daughter, Ivanka, who everybody knows has been pressing him on this. So they came out with these plans. In short, I don't mean to be too ridiculing, but the child care plan was kind of absurd. It was an extraordinarily regressive tax plan. The Nonpartisan Tax Policy Center described it as a gift to the rich. 70% of the benefits would have gone to households with income over $100,000 and 25% with households over $200,000. The plan for paid family leave was for women only, which is just about 40 years out of date relative to any other country, rich country in the world. It's absurd. And not only is it absurd, it's harmful. So I was interviewed by the New York Times. I'll simply say this, and Pamela Druckerman wrote a piece about this, and she asked me if I had spoken to the Republicans. I mean, in other words, I said that I had spoken to the Clinton campaign, had called me for policy discussion, as had the Sanders campaign. She asked if I'd spoken to the Trump campaign, and I said that I had not, but I would be thrilled if they would call me. And I mean, I did mean that very seriously. I dared Ivanka to call me via the New York Times, but she didn't. So, but the question is what will happen now. I have absolutely no idea. There is a sort of a march over recent decades in this direction. I mean, I think left and right, Michael, maybe you can speak to this, recognize that the shift from sort of the welfare mother to the working poor woman and men, of course, that shift is complete. And in fact, it was a colleague of yours, Michael, at the American Enterprise Institute said early this spring that the Trump White House was talking about a parental leave plan. I've scoured the interwebs, and I can't find any evidence for that. But apparently it's been said behind closed doors that they understand that maternity only in 2017 is really not a good idea. So, but anyway, it's on the table. I'm excited, and I hope they're serious. And Ivanka, call me. I'm ready to help.
I have one comment and one follow-up before I go to Mary. So the comment is, perhaps this was narrowly political on the part of the Trump administration, but you gave reasons to, suggest that this might be something broader than that. Marco Rubio had come out much earlier with a child care proposal of some kind. So, there may be reasons that are driven by the larger economy and larger economic forces that people will eventually put this on the table in a serious way at a federal level. So just say one more word about why you think this is good, why you think this is good for the economy.
Well, that's a good question. I think if just to step back, I do a lot of research across countries, so I think most of you have heard of the OECD, the Organization for Economic Cooperation and Development. It's a group basically of 36 rich countries. They've issued several reports. They're really not a political organization. A big theme that they've been writing about is the necessity to bring women's employment up across all of the rich countries. They talk a lot about this, it's a sort of an unpleasant term, the wasted human capital, but meaning there are enormous numbers of women who are educated and skilled and prepared to work, but who are working intermittently and part-time and are underemployed and out of the labor force, because it's just an extraordinarily, we have a very hostile environment. I don't mean in terms of sexual harassment, but I mean in terms of working conditions. So there's a lot of wasted capacity. We also see birth rates falling in a worrisome way because people can't figure out how to have children care for their families. It's certainly lowering people's wages and adding to the poverty problem. So I think there's a lot of instrumental concern about the constraints on women's employment, and that has been a discussion, I think, that has a certain bipartisan sense to it. We also know, I just might add, that family demography has changed, and huge numbers of households, the only breadwinner is in fact a woman, or the primary breadwinner is a woman, and to the extent that women aren't able to reach their full earnings capacity, which they're not for a lot of these reasons, it's creating poverty among families and children and intergenerational concerns and so forth.
Great, thank you. So Mary, our discussion for the last 20, 30 minutes has mostly been about federal policy. Obviously, this is a panel about the social safety net in the era of Trump, so that does make sense. But your job is to really make sure that people in New York are best off and least poorly impacted by federal policy. So can you talk a little bit about who you think would be most affected if we saw the most draconian of cuts?
Well, I think I've already still on.
It's on, yeah.
I first have to comment that I believe that there was a bill passed by both houses and vetoed by Nixon that would have made pre-K universal. I thought it was.
Oh, is it?
There we go. No, now you can hear me. So I was just saying that there was a bill that was passed by both houses that was vetoed by Nixon. So it managed to make it through both houses and with bipartisan support that would have made pre-K universal. But your question was, what would the cost be
Here in New York.
for here in New York? So I mentioned that 1.6 million people would have their health care coverage at risk. And of course, a key to the Affordable Care Act is the essential services that it assures without copays. As you know, a copay can be a real barrier to seeking care. We know that it is. And certain key services, for example, substance abuse treatment or mental health services, are part of the essential plan, and access to these services would be greatly reduced. In New York City, we're in the midst of a still escalating opioid epidemic. We have record numbers of people dying of overdoses, most of them related to opioids, most of those related to heroin. So we would be disarmed in terms of treatment, and there is effective treatment. But I don't want to make it seem as though access to health care is the only determinant of public health. Obviously, being healthy has a lot more to it. So, it's hard to be very specific about anything, and I think you'll hear that echoed through the panel, because we still don't really know what's going to happen. But at least here in New York, we felt really heartened by the fact that a week ago Friday, the replace part of Obamacare foundered, and the repeal effort seems to have been disarmed for now. But I think that the best turn of phrase that I heard is, we dodged a bullet, but the gun is still loaded. So it may still come. It would be very, all of these cuts in the executive budget and in the Affordable Care Act would have a very marked impact on the health of our city. There's no doubt about that.
And just a very
You
pragmatic.
mean, how are we going to plan to?
Yeah, so pragmatically, given you're a senior
our goal is
executive,
to
you're
fight
responsible,
this.
you have a multi-million-dollar budget, you have thousands of employees.
Yes.
Scores of thousands of employees.
6,000.
Okay.
Am I
6,000
off?
employees.
No.
How does one manage? How do you manage an agency with that level of uncertainty?
Well, I think that our intention is to continue to advocate strongly for what we view as bipartisan goals, which is to ensure that people have the basic services they need to have a decent life. And at the moment, where I'm not being asked to come up with a budget that reflects the kinds of cuts that might be coming. And I haven't got that budget to talk about this evening.
Okay, good. Well, I can only imagine what it's like to try to plan in multiple realities constantly. So, Michael, I want to come back to you.
I think we're all doing that in many,
Well,
many
it's true.
realms.
You know, you are a token on this panel this evening, not only the token conservative, but actually the token Washingtonian. So I wanted to ask you,
Usual for me.
which one? I wanted to ask you, given, you know, basically for the last 30 minutes, we've been talking in a very rational way about some of the policies we might like to see, some of the policies we might hope to see if we got together in terrific groups of 12 and spent a lot of time with each other with intellectual empathy. But, you know, that is really, at least from what I read in the paper, that is not the world in Washington, D.C. right now. And in particular, one of the things that is confusing and perhaps somewhat encouraging those of us on the progressive side is that there seems to be a lot of confusion on the conservative side of the aisle right now. I think those of us who live in glass houses should not throw stones, by the way, but nonetheless, there's a lot of confusion in terms of what a reasonable conservative social safety net policy writ large would look like. So can you tell us a little bit about what you think you're likely to see on your side of the aisle in the next 3.5 years?
Well, I guess, building off your comments, the gun may still be loaded, but they don't know how to fire it. You know, there. You know, I think there's a bit of a double-edged sword here. I mean, the safety net is not the focus of the Republican Party right now, and you know, perhaps that will make some people breathe a sigh of relief. That also means that it's a potential source of funding for things that are important to Republicans. We saw in the president's budget that basically non-defense discretionary programs, many of which help low-income Americans, funding was cut for those programs, and that was given to defense spending. It is likely that we will hear talk of cutting the budget for some safety net programs in order to fund tax cuts. If you think that the Affordable Care Act is a safety net program, which I think is a reasonable view, certainly that is something that has been targeted. Whether or not they're able to regroup and take another swing at that, I think is very much an open question. So, you know, I think that the administration has some pretty clear goals. They want to do tax reform. There is a building desire to actually do something on infrastructure. They want to return to the Affordable Care Act. Whether or not they'll be able to do that, again, I think is an open question. You know, so I think that the chances of Social Security or Medicare being affected are actually quite low. I think that the chances of going after some safety net programs that are not annually appropriated are reasonably low. But you know, Medicare, healthcare, those are things to keep an eye on.
Actually, so Mary, I was going to ask that question next, and this is for all of you now. One of the things that would definitely be a significant structural change to the way most of these programs are provided, although we've seen some of these changes in the past, but block granting of healthcare programs in particular would be a very significant change. So I'm not sure who to throw this to, but could somebody describe what block granting is specifically and what the likely impact of block granting would be both programmatically and politically? I don't know who wants to take that question, but I think it's an important one.
It's really an important one, but I'm not sure that I can answer it in a general way. I can speak of it from my personal experience in public health practice.
I'm going to define block granting first.
So it just means that a chunk of money is allocated, and it goes to the states as a chunk of money. And the states are given guidance on what it should be spent on, but there's no line item guidance on how that money's spent. So the experience of block grants, as I've seen it, is that they, one, shrink the budget. It's almost always a way of cutting the budget, and it absolutely reduces accountability for how that budget is spent. And in fact, it can be spent in all kinds of ways. It may not be spent on the, to support the activities that it was nominally intended to. So if we're talking about emergency preparedness, for example, you might have the CDC might have a lot of ideas about what the framework of emergency preparedness would look like. If it went to the states, they would not be able to hold the states accountable to the implementation of that framework.
Could I just add to that, block granting has been discussed for many, many years in relation to many programs. It always makes, liberals and progressives very nervous. And I think, Mary, you mentioned many important points, but it's also important to note, if you take cash assistance for the poor as an example, the block granting went hand in hand with removing the entitlement status from the law, which meant that, so just a bit of history, and I think that was probably one of the most radical changes in American social policy, certainly in decades. In 1935, the Social Security Act was passed, which created the spine of the American social policy system. That included a program that gave cash assistance basically to single women and children called ADC. It became AFDC, what we know as of welfare. And that was an entitlement program, and an entitlement program is one. What that means is that people who are eligible, it's required by law that they be served. In any case, during the so-called welfare wars of the 1990s, the law was passed in 1996. AFDC became TANF, given back to the states. But the big shock was that the entitlement status was removed from the law. So what that means now is that poor families with children are essentially at the mercy of the states in which they live. We have 50 different systems and so forth. So block granting, not only does it, it often cuts funding, it doesn't have to, it turns discretion to the states, but it also, in my view, it also really jostles the whole question of what it means to be a country, because it's always been the case that there's been state-level variation, but after TANF in particular, what does it mean to be a country? A child born in Mississippi lives in a completely different world than a child born in Connecticut. And so the point being that block granting Medicaid was on the table, it was taken off the table, it was back on the table. Now you hear these, to me it's like, sounds a little bit like a horror movie, but they're talking about block granting Medicare. So in any case, forgive me for going on too long. At some point, Michael, I'd love to hear why you're so sure these won't come back. Trump and Ryan are one of the oddest political duos in political history. Who the heck knows where they're going, but isn't Paul Ryan a fan of block granting Medicare? Why do we think it won't come back with a roar?
Well, so there are block grants and then there are block grants, right? So what Paul Ryan is in favor of is premium support, which essentially is a per person allocation, per enrollee allocation to the states of funding that would be used on a particular program. That's different than saying, okay, it's the year 2017, the state of Mississippi gets X billion dollars for this program, and we are going to adjust X by some amount going forward, and it's just going to be kind of blinded on autopilot. The same thing was true with Medicaid. The Medicaid funding mechanism is problematic. It's a matching program. If the state spends $1, then the federal government matches that, in some cases 50 cents, in some cases 80 cents. That encourages states to spend a lot of money. That's something that we should be concerned about. We should also be concerned about the quality of care that Medicaid recipients receive and what it actually does to their health The reason we want health insurance is because we think it delivers good health outcomes, not just because it's a nice thing to have. So I think there is a decent chance that if the Republicans take another swing at the Affordable Care Act, they will include Medicaid as part of that. It is not just the kind of mechanics of the legislative process. It is not clear to me that they're going to actually be able to do that. They're looking down the barrel of a government shutdown over the next month. Then they, will have to deal with that. Then, there's a debt ceiling fight that has to come up. Before we know it, Congress is going to be in re-election mode. They want to do tax reform. They want to do, maybe some sort of infrastructure thing. There's just not a lot of time on the calendar to do these really big items. But I think we could see another swing at the Affordable Care Act, and I think Medicaid could be part of that. As far as Medicare and Social Security are concerned, you're certainly right that Speaker Ryan would like to do Medicare reform. It's just the politics of that. I mean, it's not at all obvious to me why the president would want to do that. He said he doesn't want to do it. He got a lot of support from people in that age group who are Medicare eligible, certainly people who are going to be Medicare eligible in the next 10 years. It's obviously not something that he really cares about. I think the White House genuinely cares more about paid leave, for example. I think that's a real, there's a group of people in the White House who really, it's not just politics. I mean, they really would like to do that. I think if they had unlimited time, unlimited political capital, they might, Paul Ryan might talk them into doing Medicare, but I just think in a world of scarce time and scarce political resources, it's just not likely to make it to the top of the list.
So I agree, and I think medical care is different because it affects so many people and they're advocates on the supplier side. Obviously, the hospitals don't want you to pull the plug on federal spending. Where I would be more pessimistic, as is my wont, would be food stamps, where there isn't this kind of either provider or that it broadly go. I mean, there are 40 million people who benefit from food stamps, but there, I try not to follow Washington these days, but I believe somebody in power said, well, why do we need a school lunch program? It's not clear it's doing the kids any good. So I could imagine a proposal coming through to block grant food stamps, which would have much higher political prospects of passing. And the example, relating back to what Janet said, is food stamps is now the only entitlement. If you read the book $2 a Day by Luke Schaefer and Kathy Eden, you see that in the aftermath of the '96 welfare reform, food stamps has become so much more important. It's sort of a third, while other countries worry about getting people to the poverty line, food stamps gets people to something like a third of the poverty line. But it is uniform across the states, and the argument always is, well, states, if they're freed up from all the federal rules, what if we block grant WIC and food stamps and school lunch and Meals on Wheels and let the states do what they want with it? That's where you get into the TANF example, where the recession came and states didn't have money, and the block-granted TANF program, the caseloads didn't go up, and they tripled in food stamps, which was the federal entitlement. So I think that's the downside, and that may be where the Republicans are more successful in moving to block grants.
And that brings us to an interesting and important political question with respect to who are actually the alliances or the advocates in support of this range of programs. And in particular, one of the arguments that you've seen lately is that many of these programs, I think all those that you just articulated or listed, Sheldon, are vulnerable in part because most Trump voters were actually not poor. Right? Trump, in many ways, owed his victory to middle class, primarily white voters without a college degree whose incomes were truly in the middle, somewhere between $50,000 and $70,000 a year. For the most part, these folks are not, in fact, the recipients of any of these programs, and they may also, so they may have less, so there's less political support in the Trump alliance in particular for these programs. So does anybody want to talk about the fact that there may be quite weak popular support for voters who, quote, count in this constellation for these programs? Is that a concern that anybody has?
Yes. I am. I mean, I think, you know, there is a degree to which the president's core base of supporters are motivated a lot by anger. And there have been some surveys of public opinion that demonstrate that one of the targets of their anger are people who earn less money than them and who qualify, therefore, for assistance from programs they don't have.
And we haven't constructed a whole lot of programs where they feel they're getting a leg up.
Yeah.
That's not, I mean, right.
Yeah, so I think that is a source of concern. You know, I think it is true that there are that there's kind of some reshuffling of the kind of typical alliances in Washington. I think it's important, though, to keep in mind that what we learned from the Trump Care fiasco. So think about how big of a deal it is that didn't pass. Repealing and replacing the Affordable Care Act has been the motivating principle behind the Republican Party for 7 years. They won back the House of Representatives in President Obama's first midterm election. On this, it helped them recapture the Senate. Concern about premium increases specifically. It was a big factor in the 2012 campaign. It was a big factor in the 2016 campaign. It was part of what fueled populist anger that started the Tea Party. The Republicans have the White House. The Republicans have the House. The Republicans have the Senate, and and this is the first thing that they do. This is item number one when the president has his maximum political capital, and they couldn't. Not only could they not get it passed, they couldn't get it out of the House. That is a devastating failure in terms of politics, and it tells you something about the Republican Party. But it tells you a lot of bad things about the Republican Party.
You can see why I like conservatives like Michael.
You know, but maybe it tells you something good about the Republican Party too, because the Trump Care was a bad bill. It would have resulted in bad public policy.
It was an incoherent bill, right?
I know it was not incoherent. It was I think perfectly coherent. It would have created a situation where a whole lot of people couldn't afford health insurance, and so they wouldn't have had it. And it couldn't make it through. Why couldn't it make it through? This group of 30 or so House Freedom Caucus people wanted some things that resulted in a rebellion of the moderate Republicans. So, I'm encouraged by this. I mean, I don't like the Affordable Care Act. I think the Affordable Care Act is bad public policy. I would like to see the Affordable Care Act repealed and replaced with something that's better, that would push healthcare in a more conservative direction.
Can you say just 2 words about, or 2 sentences, 2 paragraphs maybe, about what you think that better, more conservative direction is?
Well, yeah, I can. Can I first say why I don't like the Affordable Care Act?
Yeah.
It's just not working the way that you would hope. Right now, there are 29 million people without health insurance. 29 million in the United States. For all this talk about universal coverage, there are 29 million people who aren't covered. So the Affordable Care Act is not meeting its own stated goal. If you look at what's happening in the states, you see that premiums for health insurance are going up. You see that health insurance companies are exiting the marketplace. You see all these states and all these counties where there are where a person who wants to purchase health insurance has only two options. You see even a handful or two states where they only have one. That's bad. That's a bad situation. It is the case that people who are purchasing health insurance through these Affordable Care Act exchanges are protected to a large degree by the premium increases, but all that means is that those costs are being socialized, and for a piece of public policy that's going to be around for decades, that's bad. That just means that everybody has to pay for them, and they're going to go up and up. I think that the design of the Affordable Care Act is flawed. It does not do enough to encourage young, healthy people to get health insurance. As a consequence, the pool of people who are insured is, in some sense, too unhealthy, which increases the cost of care. That's the principal issue. There are other issues as well. The Affordable Care Act leaves in place this link between where you work and your health insurance. I would like to see that taken away. The Affordable Care Act,
What would you like to see replace it?
well, I would like to see those two things delinked.
Michael, you're making a great case for the public option.
I was just, that's why I asked, but we'll keep going.
I am not.
I didn't think so,
No,
but
he's
keep
gonna
going,
talk-
and then I think I can just
It's an
tell Mary's
eloquent case
itching to
you've
get
made
in
there.
here, but I'd love you to finish this.
Okay, I'll finish it fast.
No,
The Affordable Care Act confuses prepayment for routine services with actual insurance meant as financial protection against unlikely events. The Affordable Care Act does not do enough to pull people in and get them covered. So I think that there's a reasonable way to move forward here. Step one is to allow health insurance companies to offer health insurance plans that don't end up covering your annual sinus infection, that don't end up covering when you have a hangnail that won't come out, that actually are insurance against very serious but very unlikely events. Those plans would be a lot cheaper. And then for people who need financial assistance to afford those significantly cheaper premiums, we pay for them. We redistribute money from people who are well off to those people so that they can afford them. Where does that money come from? Right now, if you have employer-sponsored health insurance, it's not taxed. That creates all sorts of problems with the healthcare system. You tax that. That gives you a big pot of money. That's a progressive tax that hits the rich more than the poor. You use that to give people financial assistance to purchase the plans that they need. How do you enroll more people than the Affordable Care Act? So the goal should be universal coverage, but it shouldn't be universal coverage for ear infections. It should be universal coverage for serious accidents, universal coverage for serious illnesses. I think we should look at auto-enrolling people. Rather than the individual mandate, which clearly hasn't worked, let's just sign people up and give them the option to opt out, but have the default be enrollment and let people choose to unenroll, but they have to actively make that choice. I think that would end up covering a whole lot more people than the Affordable Care Act has been able to, and it would likely be cheaper.
I can't tell if, Mary, you want to get in here.
If this is working anymore, yeah, it is
Yep,
working.
it's working. I think you
Well,
want to get
I
in
mean,
here.
maybe Jan should organize
Or Jan,
another
yeah,
session on talking about alternatives to the Affordable Care Act, because I'm not the best person to make the case against what you've just argued for. But what I would point out to you is that we've seen in New York City a 1/3 reduction in the number of people who lack health insurance. We haven't, among adults, this went from 21% down to something under 14%, and for the population as a whole. And we have fairly universal coverage for children. It went down from something just shy of 15% to a little over 9%. It's the lowest uninsured rate that we've ever documented. So going from over 40 million to 29 million is not good enough. I don't think anybody's going to argue with you, but it's the best that's been accomplished in a very long time. And it's because that people have this coverage now that they're not willing to give it up. that this is an example of how politics become local. Each one of those representatives was going to have to go home and face people who potentially would have lost their health insurance, that the efforts to reverse with this very mean-spirited plan. It says we're going to save money easy by making sure people don't have health insurance. You know, that was the design. Oh yeah, it was cheaper, but it didn't achieve its purpose, so they weren't willing to go home and talk about that. But at the same time, I know that the received wisdom is that having a single-payer system, or what people refer to as Medicare for all, is impossible in our country, even though it's done in just about every other wealthy country. I don't agree with that, and I think that that conversation is happening locally. It's happening in states. There's a bill here that is closer than I ever would have imagined. So there's another alternative to what you're talking about, which is saying that it's not going to be a tax credit, which is what people love to do here, but it's going to be an entitlement. And it's something that we're going to provide to the people of this country, because everybody needs health coverage. These skinny plans are a rabbit hole. People need to have coverage for all of their health care needs. And I don't want some bureaucrat deciding what's serious and what's not.
So we've got just a few minutes left, and I'd actually like to take, I'd like to actually take us a little bit into the future. Imagine it is 2021. President Trump is not our president. I really have no idea who our president is going to be, but just imagine that the current state of uncertainty, confusion, lack of either intellect or empathy has come to an end. And in fact, we have lived through 4 years of debates around how we should cover Americans with respect to health care, how and whether we should have work-family policies that recognize the number of two-parent or two working families, and that also recognize that we still have a lot of people in poverty who require food stamps and other kinds of cash or non-cash assistance. So I'd like anyone who wants to is there any good that can come of this confusing, I guess you could call it creative, period we're in now, where people are throwing all kinds of ideas, many not great, maybe some that are unconventional though, against the wall, such that in 2021, when we have different and hopefully more steady political leadership, some better things can come to pass. That's what I'd like us to address.
So
to
if I
close.
go back to what Michael just said, I think it's and we sort of saw that here, it's the difficulty to have measured discourse that 60% of the people might agree on. So I like the idea of taxing employer-provided health insurance. For a high-income person like me, I believe in income testing. I shouldn't not have a 25 deductible that I used to have with my health insurance when I went for my annual physical, and now it's free. I don't need that. So I think the model is, can you get in a variety of areas reasonable people who are experts? I heard somebody say, A.J. Chowdhury and Hiro Yoshikawa have a new Russell Sage Foundation book, which you can all rush out and buy, called something like Unequal Childhood, where they have a plan, which they thought the new Clinton administration would be interested in, for spending more on children from 0 to K. I thought I heard them say something like, Trump's plan isn't bad for people between 50,000 and 250,000. I think it cuts off at 250. If they would only add this on for people who are below 50. So I think it's this, but the problem is, Felicia's sort of thinking, we're going to get out of all this, and I'm thinking 2021, the Congress might be disbanded, and Trump and Bannon may be running the country without
I was
But-
the one who
but I
was
think the-
afraid of the Lord of the Flies, apparently, so I'm trying to be my better self here, but
But I think in every area, it's just we're not doing that, whether it's K-12. There are problems in the public schools, but vouchers aren't the simple solution. If you could get, but we're not in an environment, I think, we're in areas that are of deep concern to many people. You've got a mechanism by which people could sit down and work out a compromise that would improve the status quo and would be viewed that way by a large percentage of the people.
Just to pick up on that, I would say that I don't know who's going to be president in 2021. I can't even imagine. But I think that this area of increasing social protections for working people, especially those who have caregiving responsibilities, whether those are children or aging parents, I actually think there is a huge potential for some bipartisan support. I'm encouraged, Michael, by what you're saying about the paid leave, because it's been hard to know what is really going on. I would love to hear, and I'd love to be part of that discussion. I've spoken to many, many audiences in Washington over 20 years on this topic, and I really would love to hear what they're thinking about. The reason, though, that I think that there's hope there, once we can sort of move away some of the craziness and the dysfunction of this current White House, is that it is actually an old story in the U.S. On both sides of the aisle, that people believe that if you work, you should not be destitute. If you play by the rules of the game, you should not live a life of extraordinary economic insecurity. And we heard that language from the right during the welfare reform. If you get up every day and you go to work, you shouldn't live a life of economic terror. And I think that, and even moving further up, why should people be so stressed out? So all I mean to say is that is a place where I think that there's room for consensus. I remember Senator Stevenson from Alaska, the late Senator Stevenson, who was quite conservative, was a supporter of paid family leave, actually. I actually spoke to him once, and I said, why? And he said, because we have 6 kids, and I know how much work it is. But the point is that that's a place for consensus, and if the Trump administration, because of Ivanka or whoever else or whatever forces, can make this move forward, that would be historic, and I would love to be part of that.
Well, on that optimistic note, I would like to thank all of our panelists as we think forward to 2021 and a better social safety net. And thank you all for coming this evening.